All right. Hello, everyone. My name's Tyler. I'm here with Joseph today, and we're going to be giving you a presentation on hypertension and mental health. All right, so before we get started, I wanted to go ahead and define what hypertension is. So you may or may not know that hypertension is actually synonymous with high blood pressure. It's kind of known as high blood pressure colloquially, but in the medical community it is known as hypertension. So if you do go to your doctor's office and you hear them use the word hypertension, that is what it is. So it's actually defined as when the pressure pushing against your blood vessels is too high. Typically though, this is something that happens over a long period of time. So having too high of blood pressure for a long period of time actually causes damage to your blood vessels. So just a quick little reminder that blood vessels are those tiny little things that carry blood all throughout your body. So you could imagine that high blood pressure has a lot of different ramifications kind of going throughout your entire body with a lot of different organ systems. And it does relate to a lot of serious health conditions that we will be getting to in a little bit. All right, so what causes hypertension? So usually hypertension is something that develops over a long period of time. You may hear that be referred to as something that is chronic, that is referring to something that happens over an extended period of time and isn't something that happens kind of suddenly. One of the major factors that has to do with it is lifestyle choices. So for instance, not getting enough physical exercise, not making the healthiest eating choices tend to have a pretty big effect on if someone was to develop hypertension and if they were to keep having hypertension as well. So we do know that certain chronic health conditions also put you at a greater risk for having hypertension. I noted diabetes and obesity, but I do want to make a really critical distinction here and say that it is specifically those conditions that aren't being managed properly that puts you at a greater risk for having hypertension and stay having hypertension. So if you are someone with diabetes, but you are managing it, you're taking your metformin, you're making all the right lifestyle decisions, then you're at a lot lower risk of developing hypertension. Also, a quick little tidbit fact for any members of the congregation that are pregnant, it isn't uncommon for women while they're pregnant to exhibit higher blood pressure. Typically, this is something that goes away once you have a baby. Interesting enough, it's actually kind of necessary for you to have high blood pressure while you're pregnant. But if it is something that you're worried about, feel free to talk to your doctor about it. All right, so I wanted to go ahead and include some other risk factors that lead to hypertension. So that includes age, race, family history, so your genetics, tobacco use, salt use, alcohol consumption, caffeine consumption, stress, and other chronic conditions. A big takeaway that I really wanted to kind of hone in on here is the intricate relationship between inadequate water intake and high blood pressure. So you can see that a lot of these, like too much salt, too much alcohol, or caffeine, they're all diuretics. So they kind of cause you to lose a lot of water, which in turn will lead to high blood pressure. So similar to what I said earlier, hypertension is typically not a slow process, but there are certain what we call acute reasons that may lead to chronic hypertension. So for instance, some of those include obstructive sleep apnea, kidney disease, adrenal issues, thyroid issues, birth defects, and certain drugs. So when we say acute, it's something that happens kind of in the short term, or there's a sudden change that causes you to exhibit higher blood pressure. So the real big important takeaway here is, like for the example of obstructive sleep apnea, to stay on top of using your machine and really following doctor's orders to make sure that you're preventing yourself from developing a chronic issue from these things that kind of increase your blood pressure. All right, So I wanted to include a little slide here on what are kind of some of the normal and some of the elevated blood pressures. Some people I know have blood pressure cuffs at home. The big takeaway here is that a systolic of 120 or below and a diastolic of 80 or below is typically normal range, set by the American Heart Association. However, I do want to note that depending on your personalized health conditions, that your doctor and yourself may come up with different cutoffs for you that may be higher or lower depending on certain medications that you're taking or just all around the person that you are. If you are interested in knowing if you may feel like you may be developing hypertension, a fun little way to remember it is that diastolic is D for down, so it's the lower number, and systolic is the opposite of that. So systolic would be the bigger one and diastolic would be the lower one. So go ahead and take a look at these and just kind of have it in the back of your mind. But if you do have any questions, your primary care provider will definitely be able to answer those questions for you. All right, so what are some of the long-term effects of having hypertension? So heart attack and strokes are pretty big long-term effects for this. So with heart attacks, high blood pressure can damage all of your vessels, and it can kind of lead to blocking and narrowing and cutting off of circulation to your heart. What some people may not realize is that although your heart is pumping all of the blood throughout your entire body, your heart is a muscle. So it actually has its own vessels as well that kind of give it the blood and oxygen that it needs. And whenever that gets kind of cut off, it can lead to a part of your heart muscle actually dying. So it's really important that you want to stay on top of this. Similarly, strokes, kind of a similar thing is happening, cause bursting or clogging of blood vessels in your brain. So you can see that high blood pressure kind of has like this dual effect of like narrowing your vasculature as well as kind of inducing a lot of clots. Heart failure is actually another one. This one's kind of counterintuitive almost. I still struggle with this myself. But your heart, in summary, kind of wants to match the blood pressure in your body. So if you have high blood pressure, your heart wants to also be kind of matching that. And your heart's a muscle. So similarly to you working out, like your muscles, like your arm muscles or something, it's going to grow. And at a certain point, it just becomes way less efficient and it starts actually working harder. So it kind of becomes like counterintuitive for it to be doing that. Some other long-term effects are kidney disease. So your blood won't be filtered as efficiently and vision loss. Big takeaways from these two is that high blood pressure really affects the little small vessels throughout your body. So if you think about it, little small vessels aren't really used to or should be supporting like a lot of pressure within them. And they're very thin, so they tend to burst. I have a very big background in ophthalmology, so there was a lot of times where I saw people coming in with bursted blood vessels in their eyes. Angina is also another long-term effect that can mimic a heart attack in terms of pain, but it is not a heart attack. It's actually more of a problem around the heart. And overall, you kind of just have problems with your blood vessels throughout your body, usually leading to narrowing of your blood vessels. And it's just not a very pleasant thing to have happen to you because a lot of people report pain and fatigue with it. All right, so what can you do to prevent developing hypertension, or if you have it, to reduce it? Good thing is that a lot of the treatment modalities are very much accessible to a lot of people. So for one, a big way to combat this is eating healthy. One of the diets that a lot of clinicians use that they recommend to people with hypertension is the DASH diet. There's a lot to it, so I included a little infographic that you can go ahead and pause here if you wanted to kind of get a little bit more out of it. I do recommend talking to your doctor about this diet if you do have hypertension or you have fears of hypertension, seeing if this is the right choice for you. But if you are curious about it, here's a cool little infographic. Also, getting regular exercise is also a very good way to stave off hypertension as well. And that kind of goes hand in hand with maintaining a stable, healthy weight. I do want to emphasize the importance of it being a stable weight. Also, gaining or losing weight very fast isn't exactly a healthy process either, as well as limiting alcohol consumption. Going back to how important the relationship is between water intake and your blood pressure. And on to medications. So my big point of this slide was that I kind of wanted to introduce to people some of the common treatments that you may see. So if you go into a doctor's office and you're like, I've never heard of this, I just wanted you to kind of be introduced to it so you don't feel extremely overwhelmed. So it is very common for physicians to prescribe more than one medication to combat hypertension. And I wanted to include some of the common classes of drugs that you may have to take if you are developing hypertension. Those include diuretics, so you excrete salt and water, ACE inhibitors, which help you decrease vessels narrowing, ARBs, which relax your blood vessels, and calcium channel blockers, which relax your blood vessels and slow your heart rate down. I do also want to note that oftentimes, depending on the doctor, they may have you make lifestyle changes first. If your blood pressure isn't coming down to where they would like, maybe they'll add medication on top of that. Maybe they'll add medication with lifestyle changes. It just kind of depends on your own personal story. But either way, you definitely want to listen to your doctor. So big takeaways is, like I said earlier, listen to your doctor, but also stay on top of it. You know, I know that creating a new lifestyle is extremely important, but it's also very difficult, and it's a big adjustment period. So take that time for yourself to kind of acclimate yourself. If you do fall off, make sure to get back on the horse. It's okay. And make sure that if you're taking medications to really stay on top of that as well, because it's that long-term, the little things that you're doing in your life that are going to make a really big impact on hypertension. So I want to go ahead and pivot here to how important mental health is on really your entire overall health, but I will specifically frame it through the lens of high blood pressure. So there are a few different schools of thought on the research behind mental health's relationship with high blood pressure. So I think that it's kind of intuitive. I'm sure all of us have been in a room where somebody is having a stressful situation happen to them and they're like, my blood pressure is spiking right now. So one of the kind of theories about it is that when you have a stressful situation happen to you, you get this increase in blood pressure, which we kind of know. But if you're having kind of prolonged or you live in like a perpetually stressed state, there's more of a likelihood for you to have high blood pressure accompanying that for a long period of time. And like I said earlier, it's that long-term high blood pressure that causes damaging to your blood vessels. That's one school of thought. Another one is that people that tend to be stressed out also tend to cope with being stressed out. So some people may smoke a cigarette, or they may have a couple glasses of wine, or they may eat their favorite chocolate cake like I do. And those kind of ways that people cope with stressful situations kind of exacerbate the effects of hypertension as well. But although we don't exactly know the full mechanism on how this works, more than likely it is kind of a combination of multiple different factors. Researchers have also found that there's also a link between anxiety and depression with high blood pressure as well. A lot of studies noted specifically in isolation from friends and family, which I'm sure in COVID times hasn't exactly been the easiest to kind of connect with people. Also, some people aren't exactly people. So I recommend maybe getting a dog or a cat. That might actually help you too. I do think that the isolation from friends and family, which is a huge risk factor, are related to both anxiety and depression. It isn't something that is necessarily separated from it. It's usually kind of a combination of multiple of these factors. So like I said earlier, we don't exactly know the entire combination of why we're getting this intricate relationship between all of these. But what we do know is that there's a cause and effect relationship, and there is research on that, but we just don't know maybe the individual steps in between all of these. But we do believe that it has something to do with, hormone changes and physiological effects on the body. So pivoting from that, I'll go ahead and pass it over to my friend Joseph that will go ahead and take a closer look on the mental health side of things.
All right, so like Tyler has mentioned, your overall lifestyle can have a significant impact on your physical health. And a large part of that is because your mental health has a large impact on your physical health. We've seen in many different studies that they're positively correlated. One mechanism by which this happens is that conditions of high stress can wear on both your physical and mental state over time. During times of stress, your body is enacting your fight or flight response, but this isn't designed to go on for a long period of time. So when it does, it puts a great burden on your physiological systems. And this can manifest in a variety of ways. Like Tyler mentioned, it can affect pretty much any and all of your bodily systems. A stressed mental state can lead to things as large and life-changing as long-term hypertension and heart disease. And it can also make it difficult to recover from even the common cold by decreasing your immune system's function. So it really has wide-reaching effects. And while I'll go on here to address some more advanced techniques, such as different types of meditation, I think that sometimes the most important aspects of mental health are the simplest ones. I think it's important to go over these basic aspects because a lot of times they're overlooked, especially when we're very busy or stressed. First, it's important to remove any stressors that are weighing you down. You also need to find ways to express your feelings in a healthy way. And lastly, the people that you care about should know about how you're doing so that they can make things easier on you in the long run. And so removing stressors, I recognize that this step is way easier said than done. But the important point that I'm trying to get across here is that you don't actually need to solve everything in one day. And part of this process is going to be understanding that your long-term goals aren't going to be accomplished right away. But it is important to take care of all the little things in the meantime. So as a start, I would recommend that you can make a mental list of things that are weighing you down and take care of the simplest ones first. When you have a lot going on, things as simple as calling back your friend or sending an email can often get put off. But the act of putting off all of those small things can build up on your conscience quickly and cause stress. So taking care of those can help you feel a lot better. Another important thing that gets overlooked is that talking to a trusted friend or family member about what you're going through. It's a great way to express yourself. It can take some weight off your shoulders that you know someone else is there for you. And there's no need for this to be a serious sit-down conversation where you say, we're going to talk about my mental health, but just talking to someone that you know about your life, something that a lot of us do naturally already. It should be enjoyable for both of you and kind of double as an opportunity to connect. So not only does it benefit you personally, but it's going to benefit your relationship with the person you're talking to. I think that one of the main ideas here is that a lot of times our thoughts are composed of nebulous feelings like anxiety or happiness. And so actually verbalizing those feelings helps us recognize the root causes of them, kind of get in better touch with your mental state. Kind of in that same vein, there's a lot of other ways that you can organize your thoughts to make them easier to handle. Writing in a journal or cataloging your feelings in a certain app can help you get in touch with your mental state in the same way, because you're putting those feelings out into the world, you're verbalizing them, you're writing them down, and that kind of helps you organize what's really going on up in your head. Of course, you don't have to pick one method or the other, and you're free to utilize pretty much any combination of things we talk about today. This is your mental health, so it's all about what works for you personally. So here I mentioned some mental health apps that are available. There's a million different mental health apps out there. that you can choose from. Some of them cost money, some of them are free, but a lot of them have unique features that you might find useful. So again, just like writing in a journal versus talking to someone, it's all about which app has the features that you personally like. The one on the far right, Mood Fit, helps you identify triggers for negative emotions. The green one, Stay Well, it's good for tracking your emotional state. You log that along with other health data like blood pressure and eating habits. And apps like Headspace and Happify have activities for you to do based on your data. So again, how and if you use these is completely up to you. I personally prefer to stay analog and either write things out or talk about them, but there is not a right or wrong way to go about this, as long as you're expressing yourself somehow. So if none of those methods on the previous slides are providing you with clarity, it might be best to seek professional help. And this doesn't mean that you have a serious problem or that anything's wrong with you personally. It's just another way that you can express yourself in a safe and comfortable environment. It's completely normal and understandable to want to talk to someone outside of your trusted circle about what's going on. And that's what counselors are there for. They're professional listeners, and it's completely confidential. The DC Department of Behavioral Health Access Helpline is listed on their website as the fastest way to get connected to the services provided by the DC Department of Behavioral Health. This is a public health system, and they're plugged into the local network of free mental health resources, and they're committed at that helpline to helping connect you to a public health provider that's going to fit your needs. There are some other options. Friendship Place DC is a completely free clinic located on Wisconsin. They provide basic health checkup services and psychiatric services. All you need to do is call ahead and make an appointment. However, it does look like their hours are pretty limited, and being entirely private, I'm not sure what their availability looks like or what kind of resources they have. The Catholic Charities Behavioral Health Services is another highly rated freestanding clinic. I think they're also a part of the DC Department of Behavioral Health. So really that access helpline that I've listed here is probably your best bet for finding some affordable or free counseling services. So back to things that you can do in your everyday life. Everyone has things that they're passionate about and look forward to doing, whether that's painting, like Bob Ross here, or playing video games or playing basketball. It's important that we incorporate things that are making us happy into our everyday lives. This serves two main purposes. First, it can help you get through the day by making sure you have something to look forward to. And second, the action itself can be considered a form of meditation. Letting your concerns drop away for even a half hour to truly enjoy yourself can kind of help reset that stress response system and put you in the right frame of mind going forward. So as a quick aside, I wanted to bring the connection back between your mental health and your physical health. Exercise causes your brain to release endorphins and dopamine, which help mitigate the effects of stress on the body. And regular exercise has been shown time and time again to improve your overall mood and affect. I know it's never fun to get started, but very seldom will you feel bad after a workout. It gets you going for the rest of the day. And eating healthy means that you're providing quality nutrition to your body and minimizing harmful byproducts. Exercising and maintaining a good diet are both critical to mental wellness and your physiological health. So the AHA officially recommends that exercise is done a minimum of 30 minutes for 5 days a week. Within your schedule, really exercising for any amount can produce benefits, but that is the recommended amount. So, establishing open communication with those around you is another often overlooked factor in mental wellness. And like Tyler mentioned, being socially isolated is a major risk factor for anxiety and depression, which leads to further impacts on your physical health. So even if you're not coming to your close friends and family and talking about everything you have going on, it's important that they have an idea of how you're doing. Even when life is good, communication is the key to any relationship. The people who care about you have the potential to be one of your greatest strengths. If they're informed, then they can make your life easier by being supportive and understanding when times are tough. However, they won't know to do that if you never talk to them about things. So finally, we're going to discuss two types of meditation today, but there are many different forms of meditation. They range from very physical activities like Tai Chi to completely stationary ones like mindfulness meditation that we'll discuss today. The main goal of, I think, pretty much any meditation is to have control over your thoughts. Normally, your thoughts come and go as they please throughout the day. But in meditation, you're either focusing on one specific thing or clearing your mind entirely. So you're kind of, it's almost another method for organization of thoughts. It's going to train your brain to be able to better control your feelings and emotions and get in touch with your mental state. So I've listed the basics of mindfulness meditation here, and it sounds very simple. You start off in a comfortable position, you focus on your breathing, and then as thoughts enter your head, you calmly refocus on your breathing. This sounds super simple, but it takes a lot more cognitive energy than you realize to say completely focus like that. This is one of the most popular forms of meditation, and it's personally my favorite type. If you're new to mindfulness meditation, then it can be very helpful to be guided through it by a professional. There's a ton of YouTube videos available out there to ease you into the process. I've linked, it's called Video Guide here, that is one example of just a pre-recorded message that you can listen to while you meditate. And even as someone who's done this for a little while, I find it nice to go back to the videos and be guided through it. If you're not actively thinking about how to meditate, then it's easier to just focus on your breathing, you know? So there are also a number of places that do free mindfulness meditation classes here in DC. I linked there in free live guides, the Center for Mindful Living on this side, which they're currently providing live Zoom classes a couple times a week. That I think would be a great way to get into meditation. However, they're definitely not the only free meditation center in DC, and a quick internet search for mindfulness meditation free classes is going to pull up at least 3 or 4 more. And each instructor for meditation is going to have their own style. So if you're just starting out, I would definitely suggest shopping around and finding out what works best for you. And then we have progressive muscle relaxation, which is a more physical form of meditation than mindfulness meditation. In progressive muscle relaxation, you tense a group of muscles as you breathe in and relax them as you breathe out. You work through all of your specific major muscle groups in this fashion until you've relaxed your entire body. Personally, I would definitely recommend using a video guide or a teacher for this. It can be very difficult to kind of remember what muscle group is supposed to come next and clear your mind at the same time without an instructor if you're new to it. So I linked a very good video that goes through this process to this slide. So in summary, we know that your mental health is cannot be separated from your physical health. You know, they both affect each other in a number of different ways. So for this and for your own sake emotionally, it's extremely important to maintain your mental health. You can do this by dealing with your emotions in a productive and healthy manner, including by verbalizing or writing them down, utilizing a creative outlet, and communicating with those close to you. Meditation is just one other useful tool, so is professional therapy that you can use to help maintain control over your thoughts. And we even put together a mental health checklist that you can use to track all of these different factors that I believe will be sent out to you. It covers the basic points of this presentation. And so that's all we have for you today. We've got time to take any questions.
This was really great. Thank you. So for the community out there, we also have a checklist that Joseph and Tyler have kindly put together so that it is easier to follow. You can use it as much as you want or as little as you want. So that's a great thing about it. And Dave will send it out with the rest of the presentation.
Yes, good morning. Excellent presentation, Tyler and Joseph. I wanted to direct my first comment to Tyler on the hypertension. I am so glad that you touched on the fact that many times we don't drink enough water. We're not hydrated enough, and that can affect many, many things, including blood pressure. I know folks who have issues with gout, just kidney disease. A lot of times, just in making sure we increase our hydration. And I specifically mean water. A lot of times folks think, oh, well, I drink tea, I drink coffee, and they could, but a lot of times that also contains caffeine and extra sugar. So, I think the emphasis on increasing the amount of water, just be mindful of the amount of water that we consume is a very important part. And my second comments for Joseph, I especially like your comments on meditation and the effect it can have on blood pressure. And one key thing you could maybe do is to take your blood pressure before you do a meditation session and even a journaling session, and then take it again afterwards. And sometimes you can see physically what that has done, what you can see the effect on your blood pressure. A lot of times it is lower after you finish those exercises. So then you get sort of like an immediate confirmation that you're doing something good for yourself. But thank you for an excellent presentation.
I just wanted to
Thank
say
you.
we have in the chat, Angel posted here, one of the sites for mental health is located across the street from the St. Anthony Catholic Church in Northeast DC. So there's another resource there.
I did want to mention something that Charlene said really fast. First of all, thank you so much for the kind comments. And you actually reminded me of something that I meant to say during the presentation. A lot of times when you go into a doctor's office, some people are very nervous and they get stressed out and their blood pressure. And a lot of times what you notice is that 20 minutes later, when the person has acclimated, they've gone back in, rechecked their blood pressure, and it's come down significantly. So a lot of times, what people may not realize, if you have a blood pressure cuff at home, maybe don't check it if you're in a stressful situation or if you're like right after a workout. I think the real big thing that will help your doctor is if you keep a log over an extended period of time. And if there is kind of a long-term issue and you keep noting that and you take it to your doctor, then that's going to be extremely helpful for them to kind of make a more accurate clinical decision as well.
Thank you. That's a great point. And there may be, if you all are able to locate maybe a demonstration of how to take a home blood pressure, with a cuff, and include that in the link to this session, that might be helpful too for some of the folks who are viewing it.
I
I wanted to add, I think Joseph made a fantastic point. Not Joseph, I'm sorry, Tyler. I often tell patients to bring their blood pressure machines to the office to make sure that they are the same at home and the office blood pressure, so that they're calibrated properly. So that's another tip.
I wanted to thank Joseph. The destigmatizing of the counseling session, I think, is extraordinarily important. And also want to put in a plug that you can also go to your priest, like Father Mike. He has years and years of experience as counseling, but it's not that there's something wrong with you. Sometimes everyone needs to talk, and I think that's an incredibly important point to get across.
Excellent, Dave. Thank you for that. Yes.
Here's another chat, a comment from Angel. What, if any, of the mental health techniques do you use as students, teachers, and why? Do you have time to use any of these apps suggested. So put that out there.
So I personally, like I mentioned, sometimes I will go the journal route and just try to write down all my thoughts out. Even a lot of people don't like doing it this way, but I'll pull up a Word document and just, type to organize my thoughts, or talk to somebody close to me. My girlfriend, who's in vet school right now, uses that Stay Well app, and she's the one that recommended it to me. So that also gives you the opportunity to, I don't really like doing it on the phone, but you can make notes about how you're feeling, and it lets you kind of incorporate your diet in there too, and your blood pressure if you choose to do that. So
Yeah, I think for me, it goes back to what Joseph said earlier about, you have to do what's best for you. And I think sometimes I toggle between, I like to be very physically active, but a lot of times I also find myself writing it down physically to kind of get my thoughts out there. Or if I'm super stressed, I like to meditate. It's something that I think as med students, we're very aware of what we have to do for our own mental health. But I did want to open the floor to any of my classmates and see if there's anything that any of you did as well that you could recommend.
I'll quickly share it. So for me, I love music, and so I actually create like a soothing playlist that like doesn't have any lyrics. It's just like soft like melodies. And I just go for a walk and I just like listen to my music and just kind of like decompress that way. It's actually been very helpful like during this like finals period that we have right now. So just finding what works for you, I think, is like best. But if you love music, definitely try to incorporate some melodies and just something that kind of like just calms you down a bit.
that's actually, oh, sorry. I was just gonna say that's a very highly recommended technique, the using music you like to decompress. I didn't have time to put it in a presentation, but that's one that a lot of people use. So thank you for mentioning that. Sorry, Christian, go ahead.
Thanks. So similar to what Rolando was saying, finding something that you like and enjoy doing. For me, sometimes it's cooking, and I find some sort of relief from like stress or like the hustle and bustle of like everyday life, and just being able to find something that I enjoy doing. So for me, that's cooking. I also do like I honestly just like talking to people and being able to just share a connection there. That's sometimes my support system, and that's been able to help me in during times of angst or sadness or whatever it may be. But in general, I think the importance is finding whatever it is that you enjoy. That could be playing a sport, that could be cooking, that could be listening to music, whatever it may be. You'll find that just repetition of that is quite soothing.
I see in the chat that Angel has said for her, it is cleaning. Here's another comment from Angel. Especially during COVID, everyone was looking online for different types of foods and herbal ways to maintain healthy blood pressure rate. What are the top 3 foods or natural things which suggest as an alternative for taking blood pressure medications?
I think that's a very good question. I don't want to give any inaccurate information. So Dr. Castornani, can you weigh in a little bit on this? I don't want to say anything that's incorrect.
Sure. So for those who don't know, I'm a family medicine physician in DC. So I think the physician view is that there is no alternative to taking medicine, but you can get it controlled and eventually come off of the medicine once it's controlled with healthy eating, like Tyler had mentioned. DASH diet is one thing we highly, highly recommend. There are a lot of studies about garlic and, avoiding salt, that kind of thing, but long-term studies don't show that they are beneficial. So Healthy eating, lots of nuts, fruits, vegetables, avoiding red meats are what we recommend. DASH diet is I see the question from Angela. It is a whole grain based Mediterranean kind of food, which focuses on getting your vegetable, fiber, fruit intake along with water. Less red meats, more healthy fats like nuts, avocado, olive oil, that kind of thing, where your overall health improves, and avoiding red meats.
And I think we have a comment from Karen, which is running or the gym.
Okay, and this is Charlene again. One other way that St. Martin's has offered some stress relief has been Zumba classes that are offered by one of our, I'll call her parishioner, Jennifer Burthead. Now her last name is Apley. She just got married. She's been offering Zoom online, Zoom classes in Zumba ever since we had started the lockdown for COVID, and they're available twice a week. She sends out a link, and we can also make that available to you. There is a charge of $5 per class for those classes, but they're still ongoing, and I have found those to be very, very helpful for myself. So we can also make the link available to the Zumba classes as part of this. Is it? I think it's already on, isn't it, Dave?
Yeah, I haven't sent out a link in a while.
Okay.
But that's a good point. I can put that in. And really, any of the links that you guys had in your presentation, if you want to send me in a list form, I can include that with the email blast to the parishioners with your video.
Great.
Or we can do that, yeah.
Oh yes, Angel asked another question here. Is the DASH diet the same as the Mediterranean diet? Yeah.
I'll just jump in and say it is, in terms of like the food groups and the division. I think they're just like subtle differences, but the Mediterranean is also recommended.
Maybe we should end it with that. Joseph or Tyler, do you want to have closing statements?
I can go ahead and do it. So thank you everyone for coming and watching. I hope that it was really beneficial to you. If you have any questions, go ahead and feel free to reach out to us. We are here, and yeah, thank you again so much.